Hello, this is an instructional video on how to cleanse and take care of your face after an erbium laser peel or any peel procedure. When you leave our surgery center after your facial laser procedure, you'll receive a SkinCeuticals post-laser recovery kit that looks like this. When you open that kit up, initially there are instructions at the top of the kit. Do not follow these instructions. Toss that piece of paper away. Your instructions will be given to you by your doctor's nurse or your surgeon himself or herself, and those are the instructions that we want you to use. Otherwise, I'll show you how to go through this entire kit. The most important part of this kit is in the initial 24 to 48 hours after surgery. These 3 packets contain a biocellulose restorative mask. It's a very calming, cooling mask that will be applied to the face. This can be applied as often as possible, of course, until it's used up. Sometimes when you apply this mask to the face, if you can take it off carefully and put it back in a moist towelette or on a paper towel, you may be able to use it a second time, but for the most part, it's not usable after the first time. So go ahead and throw that one away, and later on, 3 to 4 hours later, you can use the second one. 3 packets of this biocellulose mask come in the kit. They're for comfort after the laser procedure. What you'll use for the first week after the laser procedure is basically just 2 products. Out of the 5 things that are located in this kit, there's only 2 that you're going to use for the first week after the procedure. That's this Hydro Balm and the skin cleanser. These 2 are the ones you're going to use for the first week after surgery while your skin is still healing from the laser procedure. You'll be very red, you'll be sometimes crusty, and these are the only 2 things you're going to use. The remaining items in this kit, the epidermal repair cream, you will not start till the surgeon tells you to, or till after you see our estheticians, and they'll tell you when to begin. This is for once the skin is healed and the pink skin is healing in. When the epidermis needs to be repaired, you'll use this, but not initially. This little bottle here is a CE ferulic. It can be very burning or stingy when your skin is not ready for it yet, so do not use this until you're told to by your esthetician, your skin health consultant. This is your sunscreen. Your sunscreen will be used after the skin is healed, usually 2 weeks following the procedure when you're allowed to go outside and be exposed to sunlight. Until then, you do not need the sunscreen because you're at home healing anyway. For the first week after your procedure, as you're healing from your intense laser peel, your skin will be very sensitive and tender to the touch. For that first week or longer, depending on how long your facial esthetician or your doctor recommends, you'll be using only the 2 products we mentioned before, the cleanser and the Hydro Balm. The Hydro Balm is an emollient covering that allows air exchange. It is not the same as Vaseline. Please don't use Vaseline. If you run out of Hydro Balm, you can use Aquaphor, which you can pick up at a local pharmacy or you can pick up at a local over-the-counter store. The Hydro Balm you'll use until you run out, and then you'll use Aquaphor after that. So you'll apply, when your face is still red and sore, you'll apply the cleanser directly to your fingers. With a little bit of warm water and clean hands, you'll use your hands afterwards to just gently massage and clean off your face. What you're trying to do is remove any of the dead skin, and you also want to be gentle so as not to cause any discomfort. So you'll just use your fingers on that, reapplying as you need, washing your hands, putting another layer of the cleanser on, and cleansing again, just using that to cleanse away any of the previous residuals. Once the Hydro Balm is off, you'll want to put a little bit more on. So you'll want to put a little bit of Hydro Balm, and again, using your clean fingers, applying light Hydro Balm to the face, the forehead, any lasered surface. There's 2 different types of gauzes that we recommend for cleaning afterwards. If your fingers are not working or you want something a little more aggressive than the fingers, there's 2 different types of woven gauze. This first gauze, you can tell, is more abrasive. It has a more abrasive surface to it. It's not as smooth, and this can be used for getting off any crusty or areas that are not as pink and smooth as the other areas. You can use this to be more aggressive. This can sometimes be overly aggressive and be uncomfortable. Therefore, this woven gauze, as you can see, this woven gauze is not textured like this gauze is. It's much smoother. This gauze is usually the easiest to use in the first week after surgery because it's very soft. So this gauze will be a little bit easier as you're wiping stuff away, again with the cleanser. So again, with clean hands, you're going to apply the cleanser to the moistened gauze. You'll apply the cleanser to that, and cleaning and rubbing that cleanser into the gauze. You'll use that gauze directly on the skin to wipe away any areas because you'll want to remove the Hydro Balm or the Aquaphor that you put on. You'll want to remove that. So you'll want to actually clean away, being aggressive, you want to clean away those areas that have that and use your all over that. If your neck is done, do the neck as well. Once that's clean, you wipe that off, gently wipe that off, and then you can reapply your Hydro Balm. So these are the steps for taking care of post-lasered skin. After that, you'll be seeing our estheticians who are experts in skincare, and they'll recommend when to start the epidermal repair if your doctor hasn't already done so. They'll also recommend when to start the CE ferulic, which is a healing formula that's very high in vitamin C, but it can be stinging at first, so don't use it until you're told to do so. And finally, the sunscreen will be used once your skin is healed and you're ready to go outside. You'll use this tinted moisturizing sunscreen to help from getting too much sun to the face. But do not use those other products until told to do so by your physician or by your esthetician. Thank you for following this step-by-step guide to your laser post-operative care. If you have any questions with anything we've gone over here, please feel free to call our office